When you will be present, you will see a case has come. Suppose chest pain, severe chest pain of a middle-aged man, commonly males, with cold, clammy sweating, semi-unconscious, complaining of chest pain. On examination, you will see the pulse is feeble and blood pressure cannot be recorded. It may be many things may happen, but the most commonest cause is coronary heart disease, which is also known as myocardial infarction, and it is very famous for sudden death. What happened? I have seen in my student life that a person known Chaudhary Babu, he went to market, vegetable market, with my father. Both of them came, and the person in his drawing room was sitting and reading a newspaper. And when tea was brought to him, it was seen that he is just holding in this way and he is dead. The most probable cause of it is, it is disturbing. Most probable cause of it is myocardial infarction, which is also known as coronary heart disease. And the cause of the disease is lack of sufficient amount of blood supply to the heart muscles. Heart is a pump, so it needs some energy and oxygen, and it is supplied by coronary artery. And coronary artery, in your anatomy, I don't know whether you have reached in the thorax, the first branch of ascending aorta is coronary artery. তাই তো? কাদের চেস্ট হয়েছে? কেউ হয়েছে? পড়েছে কেউ? You will see. Please remember, the first branch of the supplying artery from the heart is coronary artery. My heart first ensures his own supply. For this reason, if anybody asks you, you are a selfish person, your answer may be, what is the harm? The nature is selfish. Because the first branch of the ascending aorta is coronary artery, which supplies heart সারা শরীরে সাপ্লাই করছে এখান থেকে ওইখান পর্যন্ত, কিন্তু ও আগে নিজের খাবারটা নিয়ে নিচ্ছে। And what goes to blood, to heart, through blood, it is oxygen and glucose. তুমি মুরগির মাংস খাচ্ছ, ভাত খাচ্ছ গোল ঘরে বসে, but your brain is not eating this chicken and rice, because this thing is digested in your alimentary system, it is absorbed, it is assimilated, and ultimately in the liver it is transformed into glucose, which the brain, heart and other vital organs are getting for their nutrition. This is the thing. Example is the chicken and the rice. Anything you eat in the morning with breakfast, it will be ultimately converted into glucose. All these things you will read in physiology. Next thing, the patient which you have seen in the emergency or OPD, whether it started at that moment when the patient was brought, no. It started a few years, a few months before. তোমার কাছে একটা জ্বরে রুগী আসলো, খুব কাঁপছে, with severe shivering and fever. You diagnosed, provisionally it may be a case of malaria fever. Whether the malaria fever just started a few hours before the bringing the patient, no. Because malaria is caused by some parasites known as plasmodium, and this plasmodium is nurtured or developed in the body of the female anopheline mosquito. Now, a female anopheline mosquito, when bites a person who is impregnated with this plasmodium, which this insect sucks a few days before from a malaria patient, in whose blood these plasmodiums are circulating. Now, the mosquito sucked that blood with its bloody meal. This plasmodium enters into the body of the mosquito, and there it is developed, and ultimately the parotid glands of the mosquito becomes loaded with this plasmodium, and when it bites against a new person, it injects these plasmodiums. That is Plasmodium vivax, most commonly. And when these plasmodium parasites are injected into the body, it will go to the liver, and ultimately it develops, multiplies skyzones, and ultimately it liberates toxin, and this toxin will act on the different systems, thermoregulatory system of the victim, and ultimately there is manifestation of fever with chill and rigor, and ultimately there is splenomegaly, hepatomegaly, anemia, etc., etc. Now, what I want to impress on you, that when you are seeing the malaria patient in the emergency or in the OPD, the disease that started a few hours ago, it started a few days. When the plasmodium is injected by that culprit mosquito into the body of the victim. Now this, so it indicates that there is a starting point of any disease. In the emergency, in the hospital, we do not know what is the course of the disease. Here in Kolkata, you are seeing river Ganges, which is known as Hooghly. So it is at a point of time you are seeing the river is flowing, but it started at any point. That is, we know Gangotri in Himachal Pradesh, Uttarakhand. It is in the Gangotri, and it goes through Uttarakhand, UP, Bihar, and ultimately it is running to West Bengal and goes to the Bay of Bengal. And there are different tributaries, different branches, obviously, but this is the main course. So from Gangotri to Bay of Bengal. Similarly, a disease has a source and there is a termination. And last day I have told you the terminal point of a disease is 3. First one is recovery. As a physician, একটা রোগ হলে একটা পেশেন্ট আসলে you expect that or it is expected that the person will recover completely. Or just on the opposite side, death. And in the middle, what is? That is the person survived, but he is not recovered fully, which is known as disability. Suppose in case of poliomyelitis of a child, either the child may recover completely, fully, no residual effect of the disease, or the child may die, 1 to 2% cases, or there may be disability. The child survived, but it has some paralyzed leg. And the child becomes handicapped, a lame child. So, please remember the end point of any disease is either recovery or death or disability. So, every disease has its course. Suppose there is a injury in your leg and it was contaminated with tetanus spores. What I am saying, you will get explanation in your different subjects, that is in parasitology, in microbiology, etc. or pathology, and ultimately from medicines. So, the spores, tetanus spores, what is the organism? Clostridium tetani. So, when the spores enters into your body, it will germinate, multiply and liberate toxins. Now, the toxins will circulate in the blood, that is in the hemopoietic system, and ultimately it will affect the target organ. And for different diseases, there are different target organs, specific target organs. Some acting in the neuromuscular junction, some in the liver, some in the brain, some in the heart, and the other vital organs like kidney, liver, etc. Now, when these tetanus spores germinate and liberate toxins, it enters the neuromuscular junction and it will cause rigidity of the muscles. আমার মনে হয় তোমরা এগুলো বোঝো। There is rigidity or stiffness of the muscles and there is stimulation of the nerves. So, there is spasms in this way. And the first organ affected is the muscles of mastication. That is the masseter. এখানে masseter বলে দুটো মাসেল আছে জানো? কেউ পড়েছো? পড়বে, আমি বললাম এই অ্যানাটমিতেই পড়বে। So, these muscles of mastication become stiff. আর এইটা স্টিফ হলে এই মাসেলটা কি করে? আমাদের খোলা পড়া করে মুখটা, চিবোনো। What I have already said that it is the muscles of mastication. তাহলে এখানে কি হবে? সে খুলতে পারবে না, which is known as locked jaw. তুমি যদি একটা কিছু মুখের কাছে দাও, সে খুলতে পারবে না, জল খেতে পারবে না, cannot drink, cannot eat. So, there is spasm of the muscles of the mastication. And as a result of this drawing of the angles of the mouth, তাহলে কি হবে? তার দাঁতটা বেরিয়ে যাবে। without expressionless laugh. মনে হচ্ছে লোকটা হাসছে, but there is no expression. আমরা যখন হাসি তখন কি হয়, সারা মুখের মধ্যে একটা প্রফুল্লতা ছড়িয়ে পড়ে, but here without any expression there is expression of love, which is known as Satan's laugh or sardonic phasis. So this is due to, and ultimately the whole body there is spasm and clonic contraction. And remember a condition when this occiput just bends and touches the sacrum. ভাবতে পারো কি অবস্থা when your occiput touches the sacrum? There is over expansion of the muscles of abdomen and chest, and it stretched out, কিন্তু stretching এর একটা লিমিট আছে তো, so all these things কি করে, ছিঁড়ে যায়, এগুলো সব ছিঁড়ে যায়. I have seen so many patients, there is blood coagulation, and the muscles of the chest which causes respiration. Respiration কিভাবে হয়? The muscles of respiration and diaphragm expands the chest wall, and as a result of which atmospheric air to cover this negative pressure enters, and when it, due to its elastic recoil against, goes to the normal position, the air goes out, which is known as expiration. So inspiration and expiration. Inspiration is the active process. The muscles of the chest, abdomen, and mainly diaphragm expands, and the expiration, that is going out of the air from the lungs, is the passive, because it is due to elastic recoil of the muscles and chest wall. তাহলে এই টিটেনাসে কি হয়, এই muscles become stretched, broken, and ultimately paralysis, so the person died. এই যে অক্সিপুটটা টাচ করে স্যাক্রামকে টাচ করছে, তাহলে the body of the person becomes bow-like, and in Bengali it is known as, tetanus কে কি বলে, ধনুষ্টঙ্কার. So for this reason it was named as Dhanushtankar in Bengali. I don't know whether what is called in Hindi. Next thing, so I want to impress on you, that is from the entry of the organisms in the body and the establishment of the disease, there is a course. As I explained the course of a river from Gangotri to Bay of Bengal, just I have our main river of our India is river Ganges. For this reason there are so many, every river follows this same rule. So this period from the starting of the disease to its end, end means three things already. So this is known as natural course or natural history of the disease. Why we should learn the natural history of the disease? Because we'll see a episode. We have seen the episode of the disease in the hospital. Suppose we are seeing river Ganges at Kolkata, like we are seeing the patient of coronary heart disease in the OPD or emergency. But to treat the disease process completely, I have to know the total natural course. Otherwise, I cannot be a good physician. Patient আসলো, তুমি কয়েকটা ওষুধ দিয়ে দিলে, ইনজেকশন দিয়ে দিলে, পেশেন্ট হয় মরে গেল, নয় বেঁচে ফিরল। This is not rationality. You have to know why the disease occurred, how the disease developed. Otherwise, you cannot prevent. So, you have to know what are the reasons, because in those diseases, I have told you that when coronary heart disease occurs, large number of patients died, and those who survived becomes more or less out of order. That is, becomes handicap. ভালো করে কাজ করতে পারে না। A person of 55, when his physical strength is there, when his brain is matured with experience, if he suffers from coronary heart disease, he becomes totally abnormal on the standpoint of physical activity. ওই সময় তো বেশি দেবে ওই সময় সবচেয়ে বেশি সোসাইটিকে দেওয়ার আছে, কিন্তু তার করোনারি হার্ট ডিজিজ হয়ে গেল, আর কিছু করতে পারে না, একটু গেলেই বুক ধরফর করে, কোনো কাজ করতে পারে না, লেকচার ক্লাস নিতে গেলে বুক ধরফর করে। আমি এতটা যে কথা বললাম, এত জোরে জোরে কথা বললাম, এত এক্সপ্রেশন দিয়ে কথা বললাম, পারবে না। এ patient suffering, he have to live a restricted life. তাকে যদি বলো এই তো বয়স হলো, চলো একটু ঘুরে আসি, দিল্লি, আগ্রা, মথুরা, খুব কষ্ট হবে যেতে, because his heart is damaged. Now, I want to say that he was not born with that damaged heart, and ultimately his heart was in a damaged condition in his elderly age. What happened? Why his heart so much damaged? So there are so many factors. As for example, he may be a smoker, he may be a diabetic, he may be a hypertensive, he may lead sedentary habits, he may suffer from stress, he may be overweight. So these are the factors which causes this coronary heart disease. Similarly, in case of all diseases, there are these causes. So, by knowing the natural history of the disease, you know the different causes, different effects of these causes on the development of the disease, and ultimately you have to take action before the disease comes with a fatal outcome. So this is now the starting point of the disease. As I said, the entry of the, or one thing I should say, that the disease domain, যত রোগ আমাদের হয়, it was divided into two groups. One side it is communicable, and one side it is non-communicable. So this is the main divisions. No disease can stay without beyond this division. What are the communicable diseases? The communicable diseases are the diseases which are communicated to the community. As for example, I am suffering from coronavirus disease, COVID, and the viri are multiplied in my lungs, and it is coming out from my body through droplet infections. And if I sneeze in front of this person, boy, it will come out. It enters into his system, and he will develop COVID. So this disease is communicated to other person. For this reason, it is known as communicable disease. And the number of the diseases which are communicated to other persons are large. And these diseases develop from some infection, from bacteria, virus, parasites, helminths, etc. are the causes of this communicable disease. Example is respiratory tract infection, tuberculosis, influenza, measles, mumps, diarrhea, dysentery, amoebiasis, helminthiasis, and so many diseases, typhoid, tetanus. So all these diseases are transmitted from one person to another person. So all these diseases are categorized in communicable disease group. But suppose I am suffering from hypertension or diabetes, and if I close to him, if I embrace him, he will not develop diabetes or coronary heart disease. Even if I suffer from cancer, he will not develop the disease. So this disease is not communicated to others. So these are known as non-communicable diseases. And the causes of these diseases are is not infecting. Other causes. So example is hypertension, diabetes, so many, coronary heart disease, stroke, cancer, etc. So all these diseases are non-communicable disease. So what I want to repeat, that the disease domain is divided into two groups. One is communicable, another is non-communicable. Examples I have already given. And communicable diseases are usually infective in origin, and the causes are bacteria, virus, etc., etc. So every disease may be a communicable, may be a non-communicable, follows the course of the disease. If you know these things, you can take protective measures. You know the course of COVID, how it transmitted. So you know this. It transmitted through sneezing, coughing, etc. So you put a mask. So it creates a barrier for transmission of the organism. You wash your hands when you are or wearing gloves. So, or you become isolated or quarantined, so you do not come in contact with this. So, a person. What we have followed in 2021, and thus we control COVID. এবং এটা হলো কি করে? Because we know the natural history of the disease. We know the natural history of COVID, the recent example. Similarly, if you want to control tuberculosis, what do you have to do? You have to do protection. You have to isolate the patient. You have to treat the patient with effective drugs so that the organisms inside his lungs die, and he cannot spread the infection to a new person. So you know the natural history of the disease. So what I want to say, natural history of the disease is very important. From the course, that is the first starting point, to the end of the disease, the total period is known as pathogenesis phase. Pathogenesis phase. When organism enters into the body, it reaches the target organ, it multiplies, it liberates toxins, toxins circulates in the blood and reaches the target organs. So this is the course. In case of non-communicable disease, what happens? Several changes occurs due to several factors. As for example, in myocardial infarction, there is constriction of the blood vessels of the heart. So, heart is not getting proper oxygen and nutrition. Oxygen না পেয়ে কি করে? Heart is crying, চিৎকার করে আমাকে খাবার দাও, which is expressed in terms of pain. বুকে অসহ্য যন্ত্রণা। So what you have to do? You have to provide proper supply of oxygen and nutrition to the heart, and as a result of which, this is the coronary artery, there is a obstruction. So you do another way, bypass. So blood is going cannot go through this, it is going to another. Bypass কি হয়? রোডে কি হয়? তুমি যখন কৃষ্ণনগর টাউনের মধ্যে দিয়ে যাচ্ছ 34 করে, it is very much congested because people has encroached. There is so many rickshaw, vans, motors, etc. So before তোমার কৃষ্ণনগরে কিচ্ছু করার নেই, so bypass this কৃষ্ণনগর town, তাহলে তোমার অনেক সময় বেঁচে যাবে. So you go from here, you bypass this কৃষ্ণনগর town, and again, so similarly this type of bypass is done. So this is the treatment. So the total course of the disease is known as pathogenesis phase. This pathogenesis phase is again divided into two parts, early and late. In the early part, there is incubation period, as I have told previously, and in the late pathogenesis phase, there is tissue changes. These tissue changes may be reversible or may be irreversible. That is the permanent damage. As in the example I have shown, that in some cases of polio, there is permanent damage of the muscles, new muscular junctions. There is no stimulations of the muscles. So as a result of which, the muscle cannot develop, and bones also. পাটা ছোট হয়ে গেল, এ পাটা যেমন আছে ঠিক আছে, এত বড় এ পাটা হয়ে গেল, এ পাটা এইটুকু থাকলো, তো the child became lame, লেংচে লেংচে হাঁটছে. So this is in the late pathogenesis phase. Again I want to say that is the total course of the disease is known as pathogenesis phase, from Gangotri to Bay of Bengal. It is again divided into two parts, early pathogenesis phase and late pathogenesis phase. This is not all. There is, before this pathogenesis phase, there is a pre-pathogenesis period. That means it is before the starting of the pathogenesis phase. What is that? We know the starting point of river Ganga is Gangotri, but it is actually not the starting point. The starting point kothay? Those icebergs which melts, and this water is trickled downwards, and all these waters from different Borogala jal are coming to Gangotri, and ultimately from the point of Gangotri it was realized as a river Ganga. So we can say the waters which are coming from melted icebergs, ices, are not, you are not saying that Ganga. So this period, this preparatory period is known as pre-pathogenesis phase. Suppose Rajdhani Express is going from There are so many. I am giving the examples of Rajdhani Express is going from Howrah station to New Delhi. So, from Howrah station to New Delhi, it is the natural course of the disease. It is the pathogenesis phase comparable to it. But it will depart from platform number 9 at 16:15 hours. But before starting, there are so many preparatory periods. That is, the train has to come in the scheduled platform. All the crews, guard, pantry cars workers, all the attendants, drivers must arrive. Okay, foods, drinks, water, blankets, bed sheets, all should be loaded in the train. And ultimately at 16:15 hours, say, it will be departed. So before starting of the Rajdhani Express from Howrah station from platform number 9, there are so many preparatory things which is comparable with pre-pathogenesis phase. So what I want to say that in the pre-pathogenesis phase, everything is present, but disease had not started. The disease process started from pathogenesis phase. And as all the factors, already we have described that agent, host and environment, everything is ready. That is, you are in the midst of this environment of COVID, organisms is present, atmosphere is present, and you host is present, but disease has not started. Why it started at a certain point? Because there is encroachment of all the factors together, and as a result of which there is some interaction. This interaction point is the starting of the disease. যেটা আমি বললাম, so what we can derive that all of us are in the pre-pathogenesis phase. এখানে তুমি আছো, হোস্টেলে ফিরে গিয়ে দেখবে জ্বর এসে গেল, starting of the pathogenesis phase. হোস্টেলে যাওয়া মাত্র তো তোমার জ্বর আসতে পারে না. There is some preparation inside your body. So this is known as pre-pathogenesis phase. So this is agent, host and environment. We are the host. Already I have told that the agent is surrounding us and environment is surrounding us, but the disease has not occurred. When occurred, there is some interaction. So this is the, so in this way, we can explain the natural history of the disease by this epidemiological triad. একটা জিনিস আমি যেটা বলছি, this subject, you are too young, too immature to realize the essence of this subject. For this reason, there is no other subject in MBBS course which covers 7 semesters. দেখো তুমি হিসাব করে সবাই শেষ হয়ে যাচ্ছে. But only this community medicine covers from first semester to end of 7th semester. So you may not give proper importance to this subject from the beginning. As for example, they say আমার তো 2টো সেমিস্টার পরেই অ্যানাটমি ফিজিওলজি, সুতরাং ওইসব পড়ে কি হবো, দেখা যাবে, স্টেজে মেরে দেবো। এত সহজ কিন্তু হবে না। যেটা আমরা দেখতে পাচ্ছি 21-এর ব্যাচটা হাবুডুবু খাচ্ছে। Next is, you will realize everybody will not be a gynecologist, everybody will not be a surgeon. So first of all you have to do the work of a medical officer. So either community medicine, you cannot understand a disease, you cannot treat a disease. এখন কি হয়েছে, মেডিকেল রিপ্রেজেন্টেটিভ এসে বলে যে স্যার এই ওষুধটা দিয়ে দিন, এটা দিন, ভালো কাজ হবে। তুমি বলে হ্যাঁ ভালো কাজ হবে, তাই তো হচ্ছে, দেখতে পাচ্ছে তো তাই। সে তার ব্যবসায়িক স্বার্থে তোমাকে ইউটিলাইজ করছে, তো ওইটা ব্যবহার করার জন্য কি হচ্ছে, তোমাকে ঘুষ দিচ্ছে, ওষুধ দিচ্ছে, গিফট দিচ্ছে, এমনকি বিদেশে ঘুরিয়েও পর্যন্ত আনছে, কারণ ব্যবসা হচ্ছে। But you have some responsibility to your co-citizens. Next is one thing, এটা মোটামুটি হয়ে গেল। So this is natural history of the disease. It's 2 divisions, pathogenesis phase and pre-pathogenesis phase. Pathogenesis phase is again divided into early pathogenesis and late pathogenesis. You will see it's, আর আরেকটা জিনিস হচ্ছে, আমি এসে একটা সুন্দর ছবি আঁকলাম, এইটা অমুক, with due respect to all subjects, but we have no picture, we have no colorful picture, we have only graphs, tables, which are prochondo niros statistics. তো যেটাকে আমি বলি যে বাজনাবিহীন গান। সেদিন রাত্রিবেলা ক্যান্টিনে খেয়ে যখন ফিরছি কিছুদিন আগে, হঠাৎ ওপরে একটা ঘর আছে, যাইনি কোনোদিন, গেছো তোমরা? ক্যান্টিনের উপরে, ডক্টরস ক্যান্টিনের উপরে যাবে, কি সব আছে, জিম টিম। তা সেখানে একটা হেরে গলায় কে যেন গেয়ে উঠলো রাত্রি 10টার সময়, তোমার দেখা নাই রে, তোমার দেখা নাই। শুনতে ভালো লাগছিল না, কিন্তু হঠাৎ করে মিউজিক বেজে উঠলো, ঝিংচাক ঝিংচাক ঝিংচাক। এবার ওর গানের সঙ্গে ওটা কিন্তু শুট করে গেল, তখন আর অত সুন্দর লাগছে না। তার মানে আমি যেটা বলতে চাই, খালি গলার গান বড় কঠিন। তোমাকে একটা ফ্যামিলি গ্যাদারিং এ যদি বলে একটা গান করো, তুমি বলে হারমোনিয়াম আছে, বললো না নেই, তবলা আছে, বললো না, গিটার আছে, না, একটা কি বলে ওইগুলোকে, পিয়ানো তো সবার বাড়িতে থাকে না, ওইসব বড় বড় সিনেমাতে দেখা যায়। হারমোনিয়ামেরই মানে ইম্প্রোভাইজড, কি নাম এ, এমনি এমনি করে বাজায়, কি গো, রিড আছে, বলতে পারছো না? সিনথেসাইজ, ইয়েস, বলো সিনথেসাইজার আছে, বলো না। তারপরে একটা খালি গলাতেই গান করো, খুব কঠিন, খুব কঠিন। তোমাকে সুর ঠিক করতে হবে, তাল ঠিক করতে হবে। আমি অতটা ইম্পর্টেন্স দিতে বলছি না, কিন্তু আমাদের হচ্ছে ওই খালি গলায় গান, সেই জন্যে মোস্ট অফ দি থিংস আর ফিলোসফিক্যাল, কনসেপচুয়াল। সুতরাং এই এখান থেকে এই এখান থেকে এই এলো, ওকে সাপ্লাই করলো, এই কাজ, এই সায়েন্স সেন্টার। হ্যাঁ, আমাদের যে ক্লিনিক্যাল পার্টগুলো আছে সেখানে আমাদের ডিজিজগুলো আছে, সেগুলো দেখবে কত ইন্টারেস্টিং। এইটা হচ্ছে কজিটিভ অর্গানিজম, এইটা হচ্ছে প্যাথোজেনেসিস, কিভাবে ঢুকছে, এইটা হচ্ছে সিমটমস অ্যান্ড সাইন্স, অ্যান্ড দিস ইজ দ্য ট্রিটমেন্ট। দেখবে তোমাদের খুব ভালো লাগবে, কিন্তু দিস কনসেপচুয়াল থিংস আর ভেরি difficult to understand, and unless you understood these facts, you cannot properly understand. To be a good clinician, you must have good knowledge of epidemiology. Without any knowledge of epidemiology, you cannot be a good clinician. So please, the time is already over, and we will meet you again. And আজকে আমার ইচ্ছা ছিল কতগুলো ব্যাটারিজ অফ ডেফিনিশনস তোমাদেরকে পড়ানো, কিন্তু আজকে আমার সময় হলো না। 25টা। যেমন ধরো তুমি বসে আছো, তোমার বন্ধু ফিজিক্সে ভর্তি হয়েছে, বিএসসি ফিজিক্স আছে, সে তোমাকে বললো কি নাম তোমার?
সৌম্যদীপ্ত সরকার স্যার।
বাড়ি কোথায়?
ইংলিশ বাজার, মালদা।
মালদা থেকে। আচ্ছা বসো। সে তোমার সঙ্গে দেখা হলো ছুটিতে, বললো সৌম্যদীপ, হোয়াট ইজ ইনফেকশন? ইনফেকশনটা কি রে? ইনফেকশন করে, ইনফেকশনটা কি বলো দেখি, ইনফেকশন মানে কি? আমি কোনো কিছু মানে তোমাকে প্রেশারও দিচ্ছি, বসেই বলো, কোনো লেগ পুলিং হয়, তোমার সাধারণ আইডিয়াটা কি?
স্যার ইনফেকশন হচ্ছে এমন এক ধরনের একটা রোগ যেটা মানে যেটা অনেক জায়গাতে ছড়াতে পারে।
For your kind information, infection does not imply disease. ইনফেকশন হলে ডিজিজ হতেও পারে, নাও হতে পারে। ও বলছে এমন একটা রোগই নাই এটা। তাহলে সরি হওয়ার কিছু নেই, সবে হায়ার সেকেন্ডারি পাস করে এসেছ, সরি হওয়ার কিছু নেই। আমি পাস করেছি সেই 79-এ, মানে ওদিকে 41 বছর আর এদিকে 24 বছর। কত হলো? 41 না 31, 55 বছর হলো। আমি জানি না কত কিছু, নিজেকে অত মহান বলবো না, সেই নিউটনের মতন নুড়ি কুড়িয়ে বেড়াচ্ছে। এই ইনফেকশন মানে কি বলো তো, কি তোমার আইডিয়া? তোমাকেই বলছি। হ্যাঁ, ব্ল্যাক ইনফেকশন শুধু কি তাই? একজন থেকে আরেকজন বলছো কেন? একজনের সম্বন্ধেই বলো, ওটা তো তোমাকে আরেকজনকে টেনে আনতে হচ্ছে। ফরেন পার্টিকেলস মানে ডাস্ট, মানে প্যাথোজেনিক অর্গানিজম। প্যাথোজেনেসিস কিন্তু ওই যে আমি বললাম, বসো, ইনফেকশন ডাজ নট ইমপ্লাই ডিজিজ। তাহলে ডিজিজ যদি না হয় তাহলে তার প্যাথোজেনেসিস কোশ্চেনটা আসছে কোত্থেকে? আর কেউ বলবে কিছু এদিক থেকে? ইনফেকশন সম্বন্ধে আইডিয়া কি? এতদিন তো কবে থেকে শুনছে বলো তো কথাটা, ইনফেকশন হয়েছে, ও বলে আমার ইনফেকশন হয়েছে। ইনফেকশনটা কি বলো, চেষ্টা করো। প্যাথোজেন অনেকটা কাছে এসছে। প্যাথোজেন বলবে না, বলে pathogenic microorganisms. Infection is a state in which some pathogenic organism, it may be bacteria, it may be virus, already I have told, maybe helminths, maybe parasites, enters a pathogenic organism which enters into the body and multiplies, but it may cause disease or may not. ইনফেকশন হলো, অর্গানিজম ঢুকলো, মাল্টিপ্লাই করলো, but there is no occurrence of it. So this is infection. And when disease occurs as a result of infection, it is known as infectious disease. ওকে, তো অনেকেই বলেছে ইনফেকশাস ডিজিজটা বলেছো, তোমার ডেফিনিশন মোটামুটি কাছাকাছি। ইন দিস ওয়ে দিস কমন টার্মস, সো দুটো হয়ে গেল, ইনফেকশাস ডিজিজ দ্যাট ইজ দ্য ডিজিজ হুইচ অকার্স অ্যাজ এ রেজাল্ট অফ ইনফেকশন, যেমন ইনফ্লুয়েঞ্জা, কোভিড এক্সেট্রা। অনেক অসুখ আমার হয়নি, মোস্ট অফ দি অসুখ ডিজিজেস, কিন্তু কোভিডটা হয়েছিল, ওই জন্য কথায় কথায় কোভিডের নাম চলে আসে। এইরকম 25টা ডেফিনেশনস আছে, খুব কমন, প্রতি পদে তোমাদেরকে ফেস করতে হবে। সুতরাং আমার ইচ্ছা ছিল এইগুলো বলবো, পরের দিন বলবো সুযোগ হলে দু একটা করে। ওকে।